welcome to DeKalb Medical. More particularly, welcome to our new renovated emergency department at our North Decatur campus. We hope that this facility will help our community receive better service, better clinical service, and more swiftly.
This renovation has been a long time coming. It's been over 20 years since we've had significant renovations to our emergency room. Our volume has grown over 20,000 visits a year, not to mention the level of care that's required by our community these days has increased.
When you walk in the door of a hospital, you expect an ED to be up to date and modern looking and clean. So knowing that this is the front door of our hospital, it had to become a priority.
Our renovated emergency department would not be possible without the generosity of our community donors. This includes our dedicated employees, physicians, and individuals.
$2.1 million was raised from you, the community, to help us do this project. $100,000 of that came from the very physicians who work behind me here.
We had the buy-in and the input and the perspectives of our patients, our communities, our nurse leaders, the nurses that work on the floor, the doctors, the PAs, the techs, everyone, so that we can make this the best place for you to receive care when you're at your sickest.
We've added 14 patient care spaces, so we are looking to decrease our left without being seen, decrease our wait times, thereby improving the patient's perception of their care.
One of the things with the renovation of the emergency department has been an improvement in the availability of rapid assessment of patients in our triage area.
We really want to keep patients that are here for minor complaints not always having to wait for hours and hours for a main ED bed, and to keep them up front so that they're going to be able to be seen very quickly and efficiently through our system without necessarily having to get a bed in the main emergency department.
One of the major improvements that we've made is around the medical core. We've positioned all the desks and everything within that area so that it is patient-facing. All the physicians and as well as the nursing staff, all the clinical people in that space are able to have line of sight into all the patient rooms.
So if you look around at the rooms, the nurses are facing right at their patients' rooms. This gives us access to you, lets us know how you're doing, and makes us available.
We have an X-ray section in the emergency department that's specifically designed to do emergency department X-rays. We actually see our patients needing films a whole lot faster, and it decreases their turnaround times and their length of stay in the emergency department.
We are the only ED in Atlanta that has what's called an EMS area.
We've established an EMS receiving room as well as an EMS holding room.
This space will have up to 10 recliners where we can actually have the patient sit. In this space, there'll be a dedicated nurse and a dedicated tech. Protocols such as for the chest pain, getting our troponins, our x-rays will easily be obtained so that these patients can be swiftly seen in our emergency department.
So now, because of our new reconfigured EMS bay, we're able to see those patients much quicker. And what happens is the EMTs are out in the community a lot faster.
There's been a lot of coordination, time, energy, and effort by our administrative team, our foundation, our board, our construction team, our project team, and our clinical operations team to provide the best healthcare environment here in DeKalb County.
But our mission is to make sure that you get the right care at the right place with the right provider.